All right, well, today we're here to both announce the numbers to date of people who have been screened and the outcomes of the screenings that have occurred for coronavirus, novel coronavirus here in New South Wales, but also to hear about some exciting news from Professor Dwyer, who will talk to us, and I'll address that in a moment. But first of all, can I just indicate that the number of people screened from the airport since the 2nd of February, 14,500 people have been screened. Of those numbers, 57 people had symptoms that needed further testing, but I'm very pleased to say every single person has shown negative result. We also have had, of course, the 4 confirmed cases. They were much earlier in the piece, and of those, 3 people have gone home and 1 remains in Westmead Hospital. Now, that particular person has had some very positive scientific results of the way he is coping with the virus. Professor Dwyer will tell us in more detail, but I'd just like to indicate that out of every negative comes a major positive, and this particular patient has shown a propensity to have the virus much longer than the other 3 people, and as a result, our public health pathology unit that Professor Dwyer represents has been able to isolate the virus and to actually do some further studies which have looked at the variants. And I understand there have been up to about 8 separate variants that have been looked at, 2 full genome sequencing, and that's an incredible outcome for us in terms of being able to help the World Health Organization come to grips with how this particular virus can vary, particularly as it's a very, very new virus. And I think before we ask Professor Dwyer to actually say a few words, I'll ask our Chief Health Officer, Dr. Chant, to say a few words, and then we'll ask Professor Dwyer to give us the expert views on these matters. Dr. Chant.
Thanks, Minister. I'd just like to acknowledge the community's response to date. Very much appreciate that the testing numbers have continued to climb, reflecting the fact that people are hearing the message around coming forward for testing, because whilst we're in this phase of containment, we are attempting to find any cases in the community so we can put that public health action around them. So thank you. I would also urge those returning travellers from mainland China to ensure that you're complying with the self-isolation procedures, and to also be aware of the information on our website that supports you identifying the sorts of activities you can undertake and those that you cannot. So once again, I'd also like to acknowledge the assistance of the Chinese community in getting the messages out. Both our doctors in that community, our Chinese medicine practitioners, and also the broader community response has been great. But again, can I reiterate, there is no place in New South Wales that I would have any qualms walking around with myself or my family, and I wouldn't be wearing a mask in public. So masks need to be kept for those patients with symptoms. They're not required in the general population. So thank you, Minister.
Professor, I'll just ask Professor Dwyer now to actually address us in terms of the amazing research. As they say, New South Wales has invested very heavily in our public health and pathology, and this is an incredible result. So I'll ask Professor Dwyer just to take us through exactly what has occurred.
Thank you very much, Minister. So what we've done at the New South Wales Health Pathology Laboratory at Westmead Hospital is isolate the virus from a number of different patients, including the most ill patients, and we've also sequenced the virus genome or genetic material from those patients as well. The advantage of having the viral isolate, as we call it, is that we can confirm that our tests are working well, and we've already done that. We can also make a contribution in terms of understanding how the virus is changing around the world and how similar it is to other viruses around the world. And so we put our genetic sequences up on the World Health Organization site for people to compare. Also, by having an isolate, we can help other laboratories in New South Wales and elsewhere to develop the right sorts of tests. And we also potentially can help vaccine manufacturers and so on by providing viruses that they can then work on to hopefully eventually develop a vaccine.
You might like to just tell us about the size of the virus and the RNA.
So these coronaviruses, they're fairly large viruses as RNA viruses go. RNA is important because they're the types of viruses that vary the most and that may change from person to person, a bit like what we see every year with influenza. The technical aspects of generating the whole viral sequence from a patient is quite significant, and I think that's a tribute to the people in New South Wales Health Pathology and in the research labs at Westmead. Their ability to do that has really been terrific.
And also perhaps a bit about the patient being in the hospital for a little longer and why that has helped us to look at the variants of the virus as it sheds.
Thank you. So one of the things that we're now seeing with this outbreak as it spreads around the world, particularly in China, but also exemplified by the patient that's currently in Westmead Hospital, is that most people have a very mild illness. We know that already, but a proportion of people get sick a week or so into their clinical illness and progress with severe lung disease. And why that is a little bit uncertain. One of the reasons for isolating the virus and indeed getting the genetic sequence is that we can study why some patients do badly. And again, this is a focus of activity around the world, and I think we've made a contribution to that.
So any questions for Professor?
How many times has this happened throughout the world that the virus is genetic material?
So in terms of the full genome of the virus, and as I said, it's quite a big virus, there's over 50 of those now around the world, and we've made a contribution with a couple of those. There's only been one other in Australia up until last week, then the two from New South Wales, and there's some coming in from Queensland because they've got cases as well. But what you end up with is a large collection of these, moderated by the World Health Organization, that is open access to researchers and diagnosticians to examine and improve both research and diagnostic testing.
And from the one that you've created, have you found any differences from some of the other strains or experiences that people are reporting in different parts of the world?
So at the moment, we do see, what we've seen in our patients is some subtle variations in the genetic sequence. Whether this means anything clinically is unknown. And again, we're working to see whether that's going to be important. One of the features is that as viruses move from animals into humans, they as they spread amongst humans, as this virus is doing, they may change. And so surveying for that sort of change at the genetic level is absolutely crucial.
And how long has this patient, have you been able to work on this one patient that was isolated?
Look, I don't have details on the individual patient. That's not appropriate, but certainly the patient's been in hospital for a couple of weeks and has been really well looked after on the clinical side and is doing quite well. But we're getting regular samples from that patient to monitor both the virus and the clinical state.
Professor, you mentioned before it's helpful for vaccine manufacturers. Can you explain a bit more about why having the genetic sequence is useful for people making the vaccines?
So there are many things that vaccine manufacturers need. Two important ones are the genetic sequence of the virus, because they want to know how different is this virus from other ones elsewhere in China or in other parts of the world. The second thing they need is to be able to grow the virus so they can see how it behaves in people or in cells that are infected. And we do this, for example, each year with influenza. We grow up the virus, we work with the WHO to examine them. So you need both the isolate of the virus and the genetic sequence.
Any further questions?
Where was the other the genetic sequencing, where did that come from in Australia?
So there's one sequence that's come from Victoria. There's now a couple of sequences from New South Wales, and I believe there's a couple of sequences from Queensland as well coming online.
In the 4 cases, maybe this has already been covered, but have the patients had pre-existing conditions?
I don't have the clinical details of the patient, but in general, most of them have been reasonably well, actually. And that's one of the features of the coronavirus infection. For most people, it's a mild disease, but for people who've got underlying significant health problems or of a certain age, then they're the ones who run into trouble clinically.
Can you explain what's happening with your sequences now? They go into a global bank, do they?
They go into a global bank that's run by the World Health Organization, and they're up there for people to analyse. It's always been an open access approach, which I think is super important, and I think this is actually a development since the old SARS days, where people were perhaps a little bit more hidden about information. I think people now are much better about sharing this sort of information, and that sort of underpins whatever we do in our laboratories.
Question for Dr. Chand. There have been reports now that the coronavirus can spread by aerosol. Is that information that health authorities are looking at this stage, and does that change any of your advice, given that it hasn't really spread that much?
So we've always known in our infection control and prevention advice from the get-go was premised on the fact that it was spread by droplet transmission and also potentially the airborne transmission. The distinction is when it's likely to be spread in an airborne way. And so Professor Dwyer can comment, but when someone's more ill, they're likely to have more virus, and then when they're coughing lots, that there is a component of that is both droplet and aerosol. There'd be certain circumstances, some procedures that we do on people like nebulizers, clearly are aerosol generating, and in times like this we actually use the opportunity to switch clinicians from doing sort of nebulizer or aerosolized generating procedures to using spacers and other ways of administering some medications, just to minimise the amount of airborne transmission route. So in summary, we've always known that a component of transmission could be via the airborne route. There are some particular things that we do, either sick patients coughing, or when we put an airway down someone's neck, or when we do certain things that are going to induce them to cough, that we know there's a higher proportion of airborne transmission or likelihood of that compared to the droplet. But the precautions that we've had from the beginning have always recognised those various components. Did you want to say anything?
So I think there's a discussion about the different ways of spreading the virus, but really the most important way is when people are symptomatic, when they're coughing and spluttering and sneezing and have the runny nose. And of course, the sicker they are, the more likely they are to have a high viral load in their clinical samples. So yes, we talk about what asymptomatic shedding, and that may well have a role, but the overall important thing is really how sick people are when they come to medical attention.
Can I just add something here, and that is this. We do need to emphasise that of 14,500 people that were screened, or 14,500 people who've come through our airports since the 2nd of February, only 57 showed any flu-like symptoms, and they were screened, and there was absolutely zero of those people who had coronavirus. So the precautions that we're taking here in New South Wales are really working, and as Dr. Chant said, we are very safe to go walking around in our community. I would encourage everybody to get out there and enjoy New South Wales, particularly if the rain stops. We do need to get out there and realise that our economy also needs to be supported. Can I also add that the New South Wales pathology, where Prof Dwyer comes from in terms of his working life, is doing major work not only for New South Wales but also for Christmas Island. They've been doing testing for Christmas Island. In fact, one of our pathologists, New South Wales pathologists, is on Christmas Island working there. And I think the numbers are that there have been about 5 who have been tested from Christmas Island. Again, the good news is zero coronavirus. So at this stage, it's looking very positive, and I would encourage people to understand that being sensible, yes. If you happen to have some symptoms and you've been near China or come from China, then get it checked out. But other than that, we're doing very well.
Minister, the Australians that are still abroad, so on the cruise ship and in various other parts, do you know if there are any New South Wales residents, or do you have any update on that?
I'm sorry, you'd have to ask the Australian Minister for that, Greg Hunt. I don't know the answer to that. You wanted to ask Dr. Chant something else?
Yeah.
Dr. Chant.
I was just wondering, given the scale of this outbreak, we've seen so many people infected, are you surprised that so few cases have been found in Australia?
I suspect it's a combination of the fact that we have taken a broad range of actions, which has really attempted to both reduce the travel from the affected country, which is mainland China. we have also asked people to come forward to testing, and regardless of that, we've also asked people to take precautions like self-isolation. So I think it's a reflection that the public health measures have been effective. I think we are very watchful, as I sort of said from the beginning. We need to be watchful about what is occurring outside our borders, and that we're very connected internationally. The questions will be, how China is managing, and China's doing an amazing range of public health measures in order to dampen down infections. We're watching those data change. But also the region, just keeping an eye on whether we're seeing cases in other parts of the region or other parts of the world. All of that information, as well as better understanding the severity profile. This has really been a very important period for us to learn more about this. And I think at the first conference I sort of told you what we knew at that time. But I'm really pleased to see that our knowledge has actually very much increased, even I think the 3 weeks since we've been meeting. And I suspect in the coming weeks, we've had virus isolated. We understand a bit more about the genetic variability of the virus. We understand a little bit more about its infectiousness. We understand about, particularly for the cases that have been diagnosed that have travelled from China, the world is sort of looking at those cases and sharing data about the experience with those cases. This will all put us in a good position to make the best public health decisions going forward, but that needs to be continually modified depending on what's happening in China, what's happening in the world, and what our experience locally is.
Would you like to see those travel restrictions remain in place if they have proven effective?
They may be, like all things I've sort of highlighted, that it's got to be the right set of measures at the right time, and we've got to be watchful about the changing circumstance both in China and globally. I've emphasised before that the Australian Health Protection Principal Committee is meeting regularly to consider this, and we're actually having quite a large meeting on Thursday to look at all, with additional experts, to look at all of the data to formulate our thinking and advice to government.
All right, I think that's got it, hasn't it? Thank you very much, and thanks for everybody again attending. Appreciate that. Thank you. Thanks,
Yeah,
Mr. Dwyer.
yeah, no
Thank you very
worries.
much.
Yeah,
Thank you.